This is going to be Laboratory Data Interpretation Chemistries, Part 3. Chemistries often run in panels that contain similar information. They include electrolyte, renal function test, liver function test, glucose metabolism, lipid metabolism, and then cardiac enzyme and markers. Electrolytes. Sodium is going to be essential. You have a lot of things in your body that run off of sodium-potassium pump. Normal is going to be 135 to 145. High values on this is going to be because of dehydration, excessive saline administration, exchange transfusion with stored blood, impaired renal function. On the low values, overhydration, sodium loss, vomiting, diarrhea, sweating, GI suctioning, any loss of fluids, increased renal sodium loss, diuretics, diabetic ketoacidosis, and that would be from the hyperosmolaric state that's occurring. Addison's disease, which is adrenal insufficiency that includes aldosterone, which works off of sodium retention. And when aldosterone is secreted, you retain sodium and the pressure goes up. So if you have adrenal insufficiency and don't have enough of aldosterone being made, then you're going to lose a lot of water, and with it a lot of sodium. And then renal disease. Potassium, measured serum potassium. I will assure you that high potassium levels will stop your heart. 100 to 108 milliequivalents per liter in male and female. High values, renal failure, excessive potassium replacement. We've got our 20 milliequivalents of potassium going a little too fast. Massive tissue damage. Potassium is pretty much intercellular, so whenever we have massive tissue damage, we have a release of the intercellular compartments. It's also associated with metabolic acidosis. Low values, diuretics. Diuretics, pretty much like loop osmotics, are potassium depleting. Inadequate intake of potassium. Large steroid doses associated with metabolic alkalosis. Chloride, measures serum chloride. Chloride is pretty much essential in all the bodily fluids, and it's an essential electrolyte, and it's located in all the bodily fluids. It's responsible for maintaining acid-base balance in the body, transmitting nerve impulses, and regulating fluid in and out of the cells. Normal on this is going to be 100 to 108, both male and female, milliequivalents per liter. High values, increased sodium levels, could cause this. Sodium and chloride like to stick around with one another. Decrease bicarbonate levels, renal failure. Low values, vomiting, gastric suctioning, diarrhea, or diuretic use. Bicarbonate, or HCO3, measured serum bicarbonate. Normal should be 24 to 30 milliequivalents per liter in male and female. This is the bicarbonate buffer system, the primary acid-base regulator in your body. High values on this. How this kind of works is bicarbonate's job in life is to go around and pick up extra hydrogen ion. This is carbonic acid on your red blood cell. You have something called carbonic anhydrase. Carbonic anhydrase can easily convert this into water and CO2. Now we give it in the form of sodium bicarbonate. The sodium bicarbonate, sodium breaks off, gets taken out the kidneys, water follows it. Bicarbonate picks up the extra hydrogen ion, becomes carbonic acid. Carbonic anhydrase breaks it down if we're acidic, and then we expel the CO2 via the lungs, and the water follows the sodium. High values, base excess, metabolic alkalosis, loss of gastric contents, or diuretic use. Low values, base deficit, don't have enough base. Metabolic acidosis, the acidosis itself has used up too much of the base. Bicarbonate consumption, bicarbonate loss, increase in serum chloride levels. Magnesium, measurement of magnesium. Number one thing that I can think of with low magnesium levels is polymorphic VTAC. The normal on this should be 1.4 to 1.9 milliequivalents per liter in male and female. Calcium measures serum calcium. Calcium is important in every muscular contraction. Normal on this is going to be 4.3 to 5.3 milliequivalents per liter, male and female. If you get high values, false rise due to dehydration, kind of concentrates everything. Hyperparathyroidism, malignant tumors, and immobilization may also cause high calcium. Thiazide diuretics, vitamin D intoxication. Low values, hypoparathyroidism, chronic renal disease, pancreatitis, massive blood transfusions, severe malnutrition, false decrease due to low albumin levels or low protein levels. Albumin is a major protein in our plasma. Free calcium measured as ionized calcium. Normal is going to be 4.64 to 5.28 milligrams per deciliter. High values on this is going to be pretty much the same thing that we saw before. The tumors that we were speaking of, we'll talk about here for just a second, are because of this parathyroid-like substance. Hyperparathyroidism, metastatic bone tumor, milk alkali syndrome, multiple myeloma, Paget's disease, sarcoidosis, tumors producing a parathyroid hormone-like substance. Some tumors will excrete hormones whenever they become mature. The tumor builds enough cellular material to release it. If it transmits a substance that is similar to parathyroid hormone, this would tell you to release calcium from your bone. Vitamin D intoxication, low values, hypoparathyroidism, malabsorption, osteomalacia, pancreatitis, renal failure, rickets, and vitamin D deficiency. Phosphate measures phosphate. Normal is 1.8 to 2.6 milliequivalents per liter in male and female. High values, hyperparathyroidism, increased growth hormone, renal failure, vitamin D intoxication. On low values, hyperparathyroidism, diuresis, malabsorption or malnutrition, carbohydrate loading, or antacid abuse. Next subject we're going to talk about are renal function tests. Pretty much two things that we look at are BUN and creatinine. BUN measures the blood urea nitrogen, which is a byproduct of protein metabolism. Normal values should be from 8 to 15 milligrams per deciliter in male and female. High levels on the BUN means that they have renal disease or renal damage. If you get someone that has a BUN over 15 or has over something that we're going to say a 10-to-1 ratio with BUN and creatinine, it should be like a neon sign: I have kidney damage. Dehydration, shock, congestive heart failure, GI bleeding, and high protein diets. Low levels would be overhydration, an increase in ADH or antidiuretic hormone secretion. Creatinine measures blood creatinine levels. Normal value, men 0.6 to 1.4 milligrams per deciliter, and in women 0.6 to 1.1 milligrams per deciliter. High values mean that you have kidney disease or nephrotoxic medications that may be beating up your kidneys. Low values, low muscle mass, or muscle atrophy. Now, whenever we're looking at a BUN creatinine ratio, this measures the BUN creatinine ratio in the blood, can help determine the cause of non-normal values. Normal value should be 10-to-1 in both male and female. So if you had a BUN of 10 and a creatinine of 1, that would be a 10-to-1 ratio. However, if you had a BUN of, say, 26 and you were at 1.1, that would not. This would be over a 10-to-1 ratio, and this should resemble to your memory like a neon sign: kidneys are damaged. Ratio is 10-to-1, meaning extrinsic renal disease. If it's greater than 10-to-1, my apologies, means extrinsic renal disease, causes decreased renal perfusion, increased urea load. Treatment, hydration, obstruction removal, Foley catheter. Some things you may just not be able to treat if they have kidney damage. Rhabdo would be one of those things that the kidney damage will continue until the resolution or what's causing the rhabdomyolysis, essentially destruction of the muscle cells. The cellular material gets released into the system. Less than a 10-to-1 ratio, also meaning renal disease, chronic renal failure, decreased urea load, inhibited creatinine secretions, dialysis. Treatment, cease administration of nephrotoxic medications, or dialyze your patient. And this would be a creatinine level higher than your BUN. Indicates creatinine clearance rate, or CCR. This indicates your glomerular filtration rate, and this is the amount of urine that you're going to produce. You should produce about 30 mils in an adult per hour, and a pediatric patient should be about 1 milliliter per kilogram per hour. To figure out creatinine clearance rate, UC, urine creatinine, times the UV, the urine volume, divided by the serum creatinine, and this is going to be your creatinine clearance rate. Basic metabolic panel. BUN creatinine, the BUN creatinine ratio should always be looked at as well. Sodium, potassium, chloride, bicarbonate, and glucose. And there's a special way that we should, if we're writing this out on handwritten documentation, that we should write it. I thought I would put that as well. And that's just like so. Your sodium level here, potassium level here, chloride and bicarbonate, BUN and creatinine, and then you can look at 10-to-1, and then your blood glucose level. Basic metabolic panel. Glucose metabolism tests. Whole blood versus serum. Whole blood in male and female, average before meals should be about 80 to 120. Average at bedtime, 100 to 140 milligrams per deciliter. In the plasma, male and female, averages before meals about 90 to 130, a little higher. Averages at bedtime, 110 to 150 milligrams per deciliter. Glucose metabolism test 2 of 2. Glycohemoglobin, or hemoglobin A1C. Glycohemoglobin forms in periods of prolonged hyperglycemia. So if you're kind of uncontrolled diabetic and you've had high amounts of blood glucose, then you're going to form glycohemoglobin. Measures the percent of saturation indicated and trends over the previous 3 to 4 months. Normal values for male and female are as follows. Non-diabetics, about 4 to 6%. In a diabetics, they should be trying to get their A1C below 7%. If they're under good control, their A1C is going to be below 7.5%. If they have fair control, 7.6 to 8.9%. If they have poor control, it's going to be greater than 9%. Lipid metabolism test. Cholesterol. Normal male and female. Desirable is going to be some number around under 200 milligrams per deciliter. Borderline high is going to be 200 to 239 milligrams per deciliter. Anything over 240, you probably need to start looking at maybe some Lipitor. High levels, cause often unknown on these, but we have some indications. Dietary concerns, hereditary, pregnancy, pancreatic problems. Low levels, hyperthyroidism, severe liver damage, or malnutrition. Triglycerides. Normal, male and female. Desirable should be less than 150. Borderline high, 150 to 190. High would be 200 to 499, and very high would be greater than 500. High levels are from dietary concerns, again, hereditary, pregnancy, pancreatitis, alcohol abuse. Low levels, malnutrition or medications. HDL, normal should be a positive cardiac risk factor. Is this let me back up 1 second. The HDL is a positive cardiac risk factor. An HDL less than 35 milligrams per deciliter is normal. Total cholesterol to HDL ratio should be like in men 5.0 and in women 4.5. Negative cardiac risk factor would be an HDL 60 milligrams per deciliter. High levels, moderate alcohol intake, exercise, weight loss, all of these could cause a higher level of HDLs. Low levels, diabetes mellitus, menopause, or obesity. LDL, normal 160 milligrams per deciliter. High levels, high fat diet, hyperthyroidism, nephrotic syndrome, diabetes mellitus, familial lipid disease. On low levels, advanced liver disease and malnutrition. Cardiac enzymes. A CK measures creatinine kinase, normally in men 60 to 100, in women 40 to 150. Isoenzymes. Now here's the problem with just running a general CK. If you run a general CK and you have any muscle damage whatsoever, you're going to release this. And this doesn't have to be cardiac muscles. If we're looking at this for cardiac specific stuff, then we're going to need to look at the isoenzymes. CK1, 0 to 1%. CKMB, and this is the one that we would be looking at for cardiac, which is CK2, CKMB, less than 3%. CK3, 95 to 100%. High level is going to mean muscle disease. We can do this also by exercise. If you've just worked out, your CKMM or your CK broad range, this one up here, are going to be high. IM injections, shock, tumors of any sort will make high levels. Low levels have no clinical significance. CKMB measures creatinine kinase, myocardial band. Normals for a male, this would be improbable that they're having an MI if it's less than 10. Inconclusive if it's just bumped past a 10 to 12. And probable that they're having an MI if it's greater than 12. High levels mean myocardial damage. Low levels have no clinical significance. LDH. If we're looking at LDH 1 and 2, this is primarily the isoenzymes that we run right here. Measures lactate dehydrogenase. Normal is going to be about 40 to 90. LDH1, usually out of that sample, is about 17 to 27%. LDH2 is normally 21 to 28%. The rest of these, LDH3, would indicate a possible PE if it was high. 4 and 5 is going to be liver. So LDH3, 18 to 28%. LDH4, 5 to 15. LDH5, 5 to 15. So normally LDH1 is more or greater than LDH2. But if it's in the presence of an MI, which this is what we're talking about right here, there's a reversal. So LDH2 would be greater than LDH1. Low levels have no clinical significance. Cardiac enzymes and markers. Myoglobin. Myoglobin's, it is inside of the muscle. It's a close cousin to hemoglobin. Whenever a muscle is injured, more specifically whenever the heart is injured, it will release myoglobin into the system. So myoglobin measures myoglobin. The normal is 50 to 120. High levels would say that we have myocardial necrosis. Low levels have no clinical significance. The number one thing that we generally look at anymore, which is troponin. Troponin, if everyone will take a look over here, this is inside a muscle Z-band, and what this does is this is how the muscle contracts or shortens. So muscle length like this, and then whenever it contracts, the muscle actually shortens, and that's because these thin filaments go inside of the thick filaments and it contracts. It does this through a myosin head. But right here is where troponin is located. So for us to actually release troponin into the system, we have to have a destruction of the cellular environment. With that said, normal in male and female, troponin 1 is 0.6 milliliters. If we have something that's greater than 1.5, then we think that they pretty much should have an MI. Troponin T, 0.1 to 0.2 in an MI. High levels mean myocardial necrosis. Please look at the lab references before you bank on these totally. Each lab will have a different references set. It will tell you off to the side of the value if it's high or low. Low levels have no clinical significance. BNP, or brain natriuretic peptide, measures B natriuretic peptide. Normal in male and females is 5 to 100. High levels, and we're talking about greater than, in some books you look at, it's greater than 300, some of them it's greater than 500. Abnormal levels would say abnormal ventricular function. This polypeptide, B natriuretic peptide, essentially comes from the ventricles in response to excessive stretching. So whenever someone is in congestive heart failure because of a big heart, they'll have more of it in the system. So high levels would say CHF, or abnormal ventricular function. Low levels have no clinical significance. Liver function studies, total bilirubin is the measure of total bilirubin. Bilirubin is a byproduct of blood production and blood. Whenever we remake blood that has hemolyzed, or we're trying to recycle parts on it, which the body does. It does this through the liver and the bone marrow, and reproduces more red blood cells, but a byproduct of this is going to be bilirubin, a byproduct of the heme. High value related to indirect and direct bilirubin levels, which mean that we might have some liver failure going on. Low value is not clinically significant. Indirect bilirubin measures unconjugated bilirubin. Normal value 0.1 to 1 milligrams per deciliter. The mean is about 0.5. High value of this is going to be sickle cell disease, autoimmune disease, hemorrhage, drug toxicity. Low value has no clinical significance. So 10% of our blood that we actually make from our bone marrow here is hemolyzed. The old damaged red blood cells are macrophaged out, or eaten. They're picked up, and the heme breaks off iron, and that's reutilized, and then the heme gets changed to biliverdin and then bilirubin, and then the liver eliminates it in the large intestine and through the kidney. If the liver is failing, this will stick around in the vasculature. This is what gives you your yellow appearance whenever someone's in liver failure. Pardon me. Direct bilirubin measures conjugated bilirubin. Normal values is going to be 0.0 to 0.4 milligrams per deciliter. Mean is going to be about 0.1. High value, obstructive jaundice. This could be caused from a gallstone in the common bile duct. Gallstones. Congenital biliary tract abnormalities. Some medications can actually cause this as well. Low value has no clinical significance. Liver functions test. ALP measures alkaline phosphatase. Normal value in men 45 to 115, in women 30 to 100. High value, bone abnormality, liver abnormality, or eclampsia. Low value, scurvy, genetic defects, excessive vitamin D intake. GGT measures gamma glutamine transferase. Normal value in men 1 to 94, in women 1 to 70. A high value would say they have liver disease or possible a large amount of alcohol use. Low value has no clinical significance. An ammonia level measures ammonia. An ammonia level is a good diagnostic tool to kind of diagnose if someone is having some sort of existing hepatic coma, or they're in a hepatic coma. Waste products of protein metabolism actually create ammonia. This value measures ammonia. The normal value is 10 to 57. High value would say liver failure or Reyes syndrome. Reyes syndrome is an interaction between a virus like chickenpox or a cold virus with the use of aspirin. They don't really understand why it's caused, but it's a very rare disease that will put you into multi-system organ failure. Low value has no clinical significance. Liver function tests, ALT, measuring alanine transaminase, formerly SGPT. Normal values in men 10 to 55, in women 7 to 30. High value would suggest severe hepatitis, cirrhosis, or mononucleosis. Low value, liver failure. AST measures aspartate transaminase, formerly SGOT. Normal value in men 10 to 40, in women 9 to 25. High value, myocardial infarction, hepatitis. Low value, liver failure. Amylase and lipase are the next two. They also show us about if someone has a possible gallstone. Measures amylase. Normal value in male and females is going to be 53 to 123. A high value on this level would say that they had pancreatitis. Number one cause of pancreatitis is a gallstone in the common bile duct, or a pancreatic trauma of some sort. Low value would suggest pancreatic destruction. Lipase measures lipase. Normal value in male and females. Lipase is an enzyme that catalyzes the formation of lipids. Pardon me. A high value in this would suggest pancreatitis or pancreatic trauma. Low value has no clinical significance. And that ends part 3. If you have any questions over any of the subject material that was covered, please feel free to get a hold of me. Roy Smith at roy.smith@redlandscc.edu or smith@emsa.net. Thank you.